First of all, to thank the hardworking men and women that, despite all the headlines, it's important to reiterate that the enormous majority of the men and women that work in the VA system do a great job. We do have problems in the VA system, and they've been well documented over the last few months, unfortunately. And we've had evidence of not just systemic breakdown, but of individual staffers in the VA system that have participated in covering up the wait times and hiding information. So that's why I'm grateful that we were able to work in the Senate on a bipartisan piece of legislation that included our accountability language that I worked on with Congressman Jeff Miller of Pensacola, which basically says that if you are a mid-level executive in the VA system and you're not doing your job, you can be fired. And right now, the Secretary can't fire those individuals. I don't view that as a punitive measure. I actually view it as a fairness issue. Number one, it's about accountability, but what about the hardworking men and women that are doing a good job in the VA? It isn't fair to them that someone who's not doing their job gets a promotion or a raise or is treated the same way. Beyond that, the legislation that was passed has all sorts of other issues, from in-state tuition for veterans, because oftentimes a veteran finds himself in a situation where they can't afford to go to college, even with a GI Bill, because of the price and the costs. To allowing an individual veteran, if they live far from a facility or if the wait times are too long, to be able to use a non-VA hospital and a non-VA doctor to get their care. There's differences between the House and Senate bill. They're going to have to be worked out, but I'm confident that we'll make progress and we'll get something done. But this it goes without saying that the people who have served us in uniform, who have risked their lives, many of whom almost lost their lives in the service of our country, were made fundamental promises, and one of them is that when they came home, we were going to care for them in the best possible way. And this news about the fact that many of them have been waiting, in some instances at the cost of their lives, for quality care is unacceptable. And I'm glad that in a day and age where not much is happening in Washington on this issue, there's been progress.
Senator, this bill is considered a watered-down version of your bill. Are you completely happy with the compromise?
Well, from the aspect of my bill, it's not watered down. The aspect of my bill is pretty strong. It basically says that if you're a mid-level executive and the secretary and you're not doing your job and the secretary fires you, you're fired. Now, you do have a 7-day appeals period. You do have to have a 21-day period where that appeal can be resolved, but you're not going to be paid during that appeal process, which is different from what Senator Sanders originally wanted. He wanted them to be paid while they waited 60 to 90 days for the appeal to work through. As I've said repeatedly, the evidence shows that if you're not doing a good job at the VA, you're likelier to get a bonus or a promotion than you are to be fired. That will change if we can get this passed.
Did anything stand out to you specifically about this hospital during your visit?
Well, look, this is a hospital that's had some issues that have been documented, but it also, in comparison to other facilities, has done better. The initial report found that this hospital didn't have some of the systemic issues that other hospitals faced. They would be the first to tell you that they can improve, that they've had instances that they've identified where they need to get better, and they're working at doing that. But we came here today to do a couple of things, to remind people that the majority of the people that work in the VA are doing a good job, and the veterans will tell you that. But that doesn't mean there aren't problems, that those problems don't need to be addressed. We have serious problems in the VA, and in some facilities it's worse than in others.
Can you comment on the state's lawsuit to try and gain oversight of the federal facilities?
Well, I certainly think the state had the right to file that. Well, the courts will ultimately decide it, but I think the position the governor has taken is that these are healthcare facilities operating within the state of Florida, and that the state has a vested interest in ensuring that they're providing quality care. And I'm not quite sure why the VA has denied them access, and I'm fairly confident that the court will rule in favor of the state of Florida.
Do you believe the Miami?
Includes a letter, an anonymous letter that alleged a couple of specific incidents at this hospital where people died. Were you able to address those specific?
We did, and the administrators here say that those cases have explanations, that in one instance the veteran chose not to follow a course of care that perhaps would have had a different outcome. Those instances are under investigation by the Inspector General's office, and as a result of a complaint that was filed, and so we'll await the outcome of that before we have further statement. But I have no doubt that there, like any medical facility, there are going to be times when there are problems. But I think the bigger problem that we have faced with the VA in some places is that there's been instances where there's been evidence now that the staff in some places has tried to cover that up. At least from what I heard today, they're being fully cooperative with the Inspector General report. If that turns out not to be the case, of course, we'll have something different to say about it.
Can you comment on the Miami VA Chief of Staff, Dr. Vincent Gennaro, and do you believe he should remain in that job following the revelation that he surrendered his license to practice in New York and was
I am. I've read press reports. I don't know all of the details regarding it. Some of it has not been made available to us yet. I would be deeply concerned about it. There's no doubt that when you have a major hospital facility like the one in Miami being run by someone whose license was suspended by another state, who's already had disciplinary action taken against him here in Florida, there's cause to be concerned. Again, this is an example of while there is no accountability. Under current law, the secretary is quite limited in his ability to go in and fire someone. And I do think that given all of what the news that now surrounds the scandals regarding the VA, that directors like the one in Miami should consider resigning before going through the process that brings unneeded controversy to a VA that's already plagued by controversy.